An enlarged prostate, also known as benign prostatic hyperplasia or BPH, is a common condition that affects many men as they age. The prostate is a gland located below the bladder, and its main function is to produce fluid that helps transport sperm during ejaculation. As men age, the prostate gland can become enlarged, which can lead to various urinary symptoms. An enlarged prostate can press against the urethra, the tube that carries urine out of the body, causing a variety of symptoms such as frequent urination, difficulty starting urination, a weak urine stream, incomplete emptying of the bladder, dribbling after urination, and urinary tract infections. While an enlarged prostate is not a life-threatening condition, it can greatly affect a man's quality of life. This information is for educational purposes only, so speak to your doctor if you have any medical concerns. Vitamin D is an essential nutrient that plays an important role in maintaining bone health, regulating the immune system, and reducing the risk of chronic diseases. However, recent research has shown that vitamin D also has a significant impact on prostate health, specifically in reducing the size of an enlarged prostate. One study found that men with low levels of vitamin D were more likely to develop prostate cancer. It is thought that vitamin D plays a role in regulating the growth of prostate cells, which can help prevent the development of an enlarged prostate. Additionally, vitamin D has anti-inflammatory effects which can help reduce inflammation in the prostate gland and reduce the size of an enlarged prostate. One study found that men with BPH who took vitamin D supplements experienced a significant reduction in prostate size compared to those who did not take the supplements. A review of several studies on the effect of vitamin D on BPH found that vitamin D supplementation was associated with a significant improvement in urinary symptoms and a reduction in prostate volume. The review also found that vitamin D supplementation was safe and well tolerated by study participants. It is thought that vitamin D helps shrink an enlarged prostate by reducing inflammation in the prostate gland, which can help reduce the size of the prostate. Additionally, vitamin D may help regulate the growth of prostate cells, preventing them from growing and dividing uncontrollably. While the body can produce vitamin D through exposure to sunlight, many people do not get enough vitamin D through sunlight alone. Additionally, certain factors such as age, skin tone, and geographic location can impact the body's ability to produce vitamin D. To ensure you are getting enough vitamin D, it is important to eat a diet rich in vitamin D or take a vitamin D supplement. Foods that are high in vitamin D include fatty fish, such as salmon and tuna, egg yolks, and fortified foods such as milk and cereal. Vitamin D supplements are also widely available and can be found in both capsule and liquid form. Vitamin E is a fat-soluble vitamin that acts as an antioxidant in the body. It is found naturally in many foods, including nuts, seeds, and leafy greens. Vitamin E has been studied for its potential to improve prostate health and reduce the symptoms of BPH. Inflammation is thought to play a role in the development of BPH. Vitamin E has been shown to have anti-inflammatory properties which may help reduce the inflammation that contributes to the growth of the prostate gland. In a study published in the Journal of Urology, men with BPH who took vitamin E supplements experienced a significant reduction in prostate inflammation compared to those who did not take the supplements. Vitamin E is a powerful antioxidant that helps protect cells from damage caused by free radicals. Free radicals are unstable molecules that can cause oxidative stress, which has been linked to the development of BPH. By neutralizing free radicals, vitamin E may help prevent or slow the growth of the prostate gland. Testosterone is a hormone that plays a role in the development and growth of the prostate gland. In some cases, an imbalance of hormones can lead to BPH. Vitamin E has been shown to help regulate hormone levels in the body, which may help reduce the risk of BPH or slow its progression. Poor blood flow to the prostate gland may contribute to the development of BPH. Vitamin E has been shown to improve blood flow and may help reduce the symptoms of BPH as a result. If you are interested in trying vitamin E supplements for BPH, look for a high-quality supplement from a reputable brand. The recommended daily dose of vitamin E for adults is 15 milligrams, but higher doses may be necessary for therapeutic purposes. Be sure to follow the instructions on the label. One nutrient that has been found to be beneficial in the management of BPH is vitamin C, also known as ascorbic acid. It is a water-soluble vitamin that is found in many fruits and vegetables, including oranges, strawberries, kiwi, broccoli, and bell peppers. Vitamin C has potent anti-inflammatory properties that can help reduce the inflammation in the prostate gland that occurs in BPH. Reducing inflammation can help alleviate symptoms. Vitamin C is a powerful antioxidant that helps neutralize free radicals in the body. Free radicals are unstable molecules that can damage cells and contribute to the development of diseases such as cancer, heart disease, and BPH. By reducing oxidative stress in the body, vitamin C can help prevent and manage BPH. Vitamin C plays a crucial role in collagen synthesis, which is essential for the health of the prostate gland. Collagen is a structural protein that provides support and elasticity to tissues, and maintaining adequate levels of collagen can help prevent the enlargement of the prostate gland. BPH is believed to be influenced by hormonal imbalances, particularly an increase in the levels of dihydrotestosterone, DHT, a hormone that promotes the growth of the prostate gland. Vitamin C has been found to help regulate hormone levels and reduce the conversion of testosterone to DHT, thereby reducing the size of the prostate gland. Studies have shown that vitamin C supplementation can be effective in reducing the symptoms of BPH. In a randomized controlled trial, men with BPH who were given 500 milligrams of vitamin C daily for 6 months experienced a significant improvement in their urinary symptoms compared to those who received a placebo. Another study found that men with BPH who had higher levels of vitamin C in their blood had a lower risk of developing prostate cancer. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin that plays a crucial role in many bodily functions, including the metabolism of amino acids, the production of neurotransmitters such as serotonin and dopamine, and the synthesis of hemoglobin. It is found in many foods, including fish, poultry, bananas, avocados, potatoes, and fortified cereals. Studies have shown that vitamin B6 can help reduce the size of an enlarged prostate and improve urinary symptoms in men with BPH. Vitamin B6 has anti-inflammatory properties. Inflammation can cause the prostate to swell and press against the urethra, causing urinary symptoms. BPH is thought to be caused by an imbalance of hormones, particularly dihydrotestosterone, DHT. Vitamin B6 helps regulate hormone levels by converting the amino acid tryptophan into niacin, which is required for the synthesis of sex hormones such as estrogen and testosterone. Vitamin B6 is essential for the production of neurotransmitters such as serotonin and dopamine, which are involved in the regulation of the nervous system. Improved nerve function may help alleviate urinary symptoms associated with BPH. Several studies have investigated the effects of vitamin B6 on BPH. In a double-blind, placebo-controlled trial, 200 men with BPH were given either 50 milligrams of vitamin B6 or a placebo daily for 12 weeks. The results showed that the group taking vitamin B6 had a significant reduction in prostate size and improved urinary symptoms compared to the placebo group. Another study found that men with BPH who took a combination of vitamin B6 and magnesium had a significant reduction in prostate size and improved urinary symptoms compared to those who took a placebo. While vitamin B6 appears to be effective in reducing the size of an enlarged prostate and improving urinary symptoms, it is important to note that taking high doses of vitamin B6 can be harmful. The recommended daily intake of vitamin B6 for men over 50 is 1.7 milligrams, and doses above 100 milligrams per day can cause neurological symptoms such as numbness and tingling in the hands and feet. Zinc is an essential mineral that plays a critical role in maintaining prostate health. Studies have shown that men with BPH often have lower levels of zinc in their prostate tissue than men without BPH. In addition, supplementing with zinc has been shown to help shrink an enlarged prostate and alleviate BPH symptoms. Zinc has anti-inflammatory properties and inhibits the conversion of testosterone to dihydrotestosterone, DHT. However, in some men, DHT can contribute to prostate enlargement. Zinc can help inhibit the conversion of testosterone to DHT, which can help prevent prostate growth and shrink an enlarged prostate. Zinc is essential for a healthy immune system. Studies have shown that men with BPH have lower levels of zinc in their prostate tissue and blood than men without BPH. Supplementing with zinc can help support immune function, which can help reduce inflammation and shrink an enlarged prostate. Zinc has been shown to induce apoptosis, or cell death, in prostate cells. This can help shrink an enlarged prostate and prevent further prostate growth. The recommended daily intake of zinc for men is 11 milligrams per day. However, some studies have shown that higher doses of zinc may be more effective for shrinking an enlarged prostate. In these studies, doses of 50 to 100 milligrams of zinc per day were used. It's important to note that taking too much zinc can be harmful. High doses of zinc can cause nausea, vomiting, diarrhea, and other side effects. In addition to taking zinc supplements, there are other lifestyle changes that can help alleviate BPH symptoms. These include limiting caffeine and alcohol, as they can irritate the bladder and worsen BPH symptoms. Staying hydrated by drinking plenty of water can help reduce urinary symptoms associated with BPH. Eating a healthy diet rich in fruits, vegetables, whole grains, and lean proteins can help support prostate health and reduce inflammation. Finally, exercising regularly can help improve urinary function and reduce inflammation. Selenium is a mineral that is found naturally in soil, water, and some foods. It plays an important role in many bodily functions, including immune system function, thyroid hormone metabolism, and antioxidant defense. Studies have shown that selenium supplementation can help reduce the size of an enlarged prostate, as well as improve symptoms associated with BPH. Selenium is a potent antioxidant, meaning it can neutralize harmful free radicals that can damage cells and contribute to the development of many diseases, including BPH. The development of BPH is closely linked to hormonal imbalances. Selenium helps to restore hormonal balance and prevent further prostate enlargement. Selenium plays a critical role in supporting the immune system, which can help reduce inflammation and prevent the growth of abnormal prostate cells. Studies have shown that selenium supplementation can improve immune function in men with BPH, reducing inflammation and promoting prostate health. Chronic inflammation is a key factor in the development and progression of BPH, and selenium has anti-inflammatory properties. In addition to its potential benefits for prostate health, selenium has also been shown to have other health benefits, such as reducing the risk of certain types of cancer, improving thyroid function, and promoting heart health. However, it is important to note that selenium supplementation should be done under the guidance of a healthcare provider, as excessive intake can lead to toxicity. The recommended daily intake of selenium for adults is 55 micrograms per day, and the maximum safe intake is 400 micrograms per day. Saw palmetto has been studied extensively for its potential to reduce the symptoms of BPH and shrink the size of an enlarged prostate. Saw palmetto contains a variety of active compounds, including fatty acids and phytosterols, that have anti-inflammatory and anti-androgenic properties. These properties can help to reduce inflammation in the prostate gland and lower levels of dihydrotestosterone, DHT. By lowering levels of DHT, saw palmetto can help to reduce the size of the prostate gland and relieve the symptoms of BPH. In addition to its anti-inflammatory and anti-androgenic properties, saw palmetto also has antioxidant effects that can protect the prostate gland from oxidative stress and damage. Numerous studies have investigated the effectiveness of saw palmetto for treating BPH, and the results have been promising. In a 2018 meta-analysis of 27 randomized controlled trials, saw palmetto was found to be significantly more effective than a placebo in improving urinary symptoms and flow rate in men with BPH. The study also found that saw palmetto was well tolerated and had few side effects. Another study published in the Journal of Urology found that saw palmetto was as effective as the prescription drug finasteride for reducing symptoms of BPH over a 2-year period. However, the men in the saw palmetto group experienced fewer side effects than those taking finasteride. Overall, the research suggests that saw palmetto can be an effective and safe treatment option for men with BPH who are looking for a natural alternative to prescription medications. Saw palmetto is available in a variety of forms, including capsules, tablets, and liquid extracts. It is important to choose a high-quality saw palmetto supplement that contains a standardized extract of the herb, which ensures that it contains a consistent amount of the active compounds. The recommended dosage of saw palmetto varies depending on the product and the condition being treated. However, most studies have used doses ranging from 160 to 320 milligrams per day. It is important to talk to your healthcare provider before starting any new supplement, especially if you have a medical condition or are taking medication. While there are various treatment options available, including medication and surgery, taking vitamins can also help alleviate symptoms and reduce the size of the prostate gland. Incorporating vitamins such as vitamin C, vitamin D, vitamin E, beta-sitosterol, saw palmetto, zinc, and selenium into your diet can help improve prostate health and potentially reduce the size of an enlarged prostate. Maintaining a healthy diet and exercise routine can also contribute to overall prostate health and reduce the risk of developing prostate problems. If this information has changed the way you think about managing your health and supporting your body naturally, please subscribe to our channel and like this video. We are uncovering the health secrets that are often overlooked. Let's cultivate a healthier future together. Our next deep dive into wellness will be opening soon.